Hi, everyone. So my name is Dominic Carden. I'm the outgoing PGY2 internal medicine resident here at Buffalo General Medical Center, and I was asked to give everyone a bit of insight into what longitudinal rotations can do for your pharmacy school career as well as your professional career. So before going into some of the benefits of longitudinal experiences in general, I just wanted to talk about Buffalo General Medical Center a little bit and some of the reasons why I wanted to do a longitudinal rotation here when I was a P4 student. So down here, we are on the medical campus, which is comprised of Buffalo General Medical Center, Oishei Children's Hospital, a number of outpatient ambulatory care clinics through a place called Buffalo Medical Group, as well as Roswell Park. So there's a lot of stuff going on down here, and it's just a really exciting place to be. They just built the new medical school that's down here, but really revitalizing the area. So it's just very energetic, exciting place to be. It is an academic teaching hospital. It is affiliated with UB. So the culture down here is great. They really love having an interprofessional atmosphere where different professions are really collaborating in order to deliver more patient-centered care. In particular, the teaching services here love having pharmacists and pharmacy students to get their input on how they're caring for their patients. And I just really liked the culture here, since pharmacy recommendations were often accepted on these services. Because it's an academic medical center, we have a complex patient population. So when it comes to training, the more complex the patient, I think the more proficient you get in being able to deliver pharmacy services. So I've always said, on exams in school, sometimes they do a little bit of this, but often these patients are not super complex. Here, patients are super complex because it's the real world. And, there's other moving pieces that you have to consider before you start making recommendations. And the more complex the patient, the more you become really proficient in anticipating the needs of those patients and deciding what their best treatment option might be. And sometimes it's not always the number one treatment option, if that makes sense. Also, because it's an academic teaching hospital, there's a lot of UB faculty here. Obviously for the med school and for like the nursing school, as well as like the PT school, but also for pharmacy. UB faculty is literally in the hallway of the pharmacy department. So you'll be training with the people that are also teaching you in school, so you could really develop those relationships. So why a longitudinal rotation here? The reason why I chose to do a longitudinal rotation here is I wanted to stay in Buffalo. That was probably, one of the biggest reasons for me personally. There's a lot of great health systems all over the country, but if you're looking to stay in Buffalo, you really want to network within the health systems that are here. It really gives you the opportunity to familiarize yourself with a particular health system. And I think that translates to you being able to deliver better patient care and also come up with better recommendations because you just know the process in our particular health system. So you're not really, trying to figure out our policies. Obviously in the beginning, you're trying to figure out like the policies and how to present patients and how to figure out, what our role is on these services. But, you pick that up quickly and then you're able to continue those things in subsequent rotations that you're doing. And the learning curve ends up not being as steep as it is, say, if you are picking up, a brand new system, brand new policies, brand new people in every rotation that you're doing. You'll have the opportunity to go through really diverse patient populations while you're here. And you can sort of see how the process works as patients are being transferred through various services, because often they'll be on multiple services, and you'll get to see how patients are cared for. So say you start in the ICU here, those patients are usually transferred to a general medicine service, and you can see how those patients are cared for, and through I guess a different lens, because you're looking for different things in different services. So you could almost literally see a patient from admission all the way through discharge, and it's really rewarding to do that. Another thing is the application process is sort of similar to a residency, not entirely similar, but you need to apply for it. So it sort of gives you a feel for some of the things that you may want out of a residency and how to sort of write something like that, how to write a letter of intent, which I think is really important. And again, I just want to reiterate, if you're looking to stay in Buffalo, I think a longitudinal rotation is probably a really good way of networking with the people that you ultimately want to do your postgraduate training with. And there are some considerations with that as well. That sort of can prevent you from networking with more people. So it's always something to take into consideration. But by and large, I think the benefits of a longitudinal rotation far outweigh maybe the few cons that you might have. If you have any additional questions about residency or postgraduate life in general, I will give Dr. Sierra Hutchinson my contact information, and you're more than welcome to reach out. Thank you.